Well, good afternoon, everyone. Thank you so much for taking some time out of your day to attend today's nursing informational session. My name is Mark Lieb, and I am the director of the nursing programs, both the practical and the registered nursing programs on the Harrisburg campus. So what you're attending now, I hope you kind of know what you're getting into. It's an informational session for anyone who's interested in learning a little bit more about the nursing programs at HACC. This is not specific to the Harrisburg campus, but the information I'm going to be sharing is true of the program as a whole, and it can be applied to any of the campuses. So I want you to know that whether you're thinking of attending Harrisburg or some other campus, it really doesn't matter. All of this information will apply to you. And the reason we do these is because I know that there's a lot of misinformation sometimes, and rumors and other things that float around out there. Sometimes you're not sure what's true, what's not true. These sessions are some of the best sources of good information because we are going to present to you what we know to be true about the nursing program. And I want to make sure that we answer all of your questions. I've got a slideshow, PowerPoint that I'm going to go through. And as I work through it, I'll pause often so that you guys can answer, or excuse me, ask questions. I want to make sure we get a chance to answer any questions you might have. If you want to put your questions in chat, I am lucky enough today to have Mrs. Kazmi with us. She's the one that's been sending you emails. She is one of our nursing program specialists, and she can not only help to answer some of the questions in the chat, but she can also help to remind me if I'm missing those, because sometimes I get stuck just kind of moving forward. And so she'll remind me of questions as we pause. So that's kind of where we're going to be headed for about the next 2 hours, roughly. If you guys are okay with it, I'm going to share my screen and we're going to get started because we have a lot to cover. I am recording this session. Mrs. Kazmi did send out a note. I saw the chat. And what is going to happen with this is we're recording this for the benefit of all students. Obviously, for you guys, there's a benefit. But in addition to that, we're doing this for the benefit of all students. We'd like to put this out on the HACC webpage so that other students who didn't get an opportunity to attend today's session will have the benefits of seeing some of this information and hearing the right information. So we are recording simply for the fact that we can then use this as a source of information for other students. So what we're going to be looking at is basically all the information we think is important for you to know as a potential nursing student at HACC. And what I want to point out initially is that we have recently changed our school organization. So what that means is the nursing department now falls under what's called the School of Health Science. So the School of Health Science is a large school within HACC, and what they oversee is all of the health careers programs. So respiratory therapy and diagnostic medical sonography, dental hygiene, they are all part of the School of Health Science. And then overseeing that school is one dean, and that's Mrs. Dory Allman. And then there's an associate dean, Dr. Megan Brightbill, under her. And then specifically within that school is two different areas. One is the Department of Nursing, which is what you're interested in. And the other is the Department of all the other health careers. Because nursing is so large, we are our own department, and then all the other health careers fall under another department, okay? Basically, why any of this matters to you, because of this reorganization, we are strongly for what's called a one college, one school, one program model. That simply means that regardless of the campus you attend, the education you are going to receive, the courses that you will take, the expectations that you will find yourself under are the same. So therefore, while you might attend a different campus than another student, the organization and the experience that you will have is the same, and it is all under one umbrella so that there is less chance of diversity in terms of expectations or those types of things where we could sometimes find difficulties. So please know that the education, regardless of the campus, is going to be the same. You may or may not know a lot about what a nurse is. And the purpose of this lecture isn't to give you every detail of what a nurse is, but I do want to point out that nursing is a very in-demand profession right now. If you are interested in nursing, you're choosing a good time to go in. Because obviously, with everything going on in the world, with the global pandemic, and with the fact that frontline workers and nurses are getting fatigued and worn out and overworked, hospitals have a great need for more nurses. So that will not change even if this pandemic does die down. I can guarantee you that the work of a nurse will go on, and you will have a great opportunity in the future for job security and for choosing jobs and basically being able to have a lot of opportunity in front of you. So essentially, there are two entry types of nurses that enter the field of nursing. HACC offers a pathway for both. There is the registered nurse pathway, and graduates of a registered nursing program can graduate from a diploma program. They can graduate from an associate degree program, which is what HACC is, and they can graduate from a bachelor's degree program. Think Messiah or York College or something like that. But all of those are registered nursing graduates, and they all take the same test to become licensed. And the practical nurse is the other entry pathway, and HACC does offer a certificate as a practical nurse as well. That's the only offering within the practical nurse entry level. And so either pathway, HACC has a door for you. And then once you get into the field of nursing, there's a lot of further steps that you can take. After you complete your RN and ideally go on for your bachelor's degree in nursing, which many of you do, or many of our nurses do, then you can enter what's called the advanced practice area. And the advanced practice area increases your job opportunities, it increases your pay, it increases your responsibilities, but you can further go on for things like a nurse practitioner or a nurse anesthetist or a nurse midwife. And each of these has different roles and responsibilities and different opportunities within them. All of these are open doors for you once you become a nurse. So what's the difference between an RN and a PN? And this kind of gives you a little bit of an idea. They are both considered nurses. The difference being that the practical nurse obviously has a different licensure exam that they have to pass. They pass a PN exam, which tests them at their expected level, and the RNs test at their expected level. But practical nurses do more of the kind of coordination and the collecting of information. They care for more stable patients, and they have a lesser responsibility within the healthcare team. It doesn't mean that they're any less of an important piece. They simply have a lesser responsibility based upon the education that they've received. The registered nurse, because of a higher level of difficulty, because of a higher level of responsibility, and therefore a higher level of pay, does have additional responsibilities. And you can see here that the RN would manage the care of the team. They would assess the patients, and they would be the ones caring for more unstable and complex patients. And their critical thinking would be at a slightly higher level and expected to be there because of those unstable patients. So again, there are differences between the PN and the RN, but there is absolutely no lesser degree of nurse in terms of the importance that they have for our patients out in the healthcare arena. Some skills that you just need to be thinking about. Something that is important to nursing is that we are a STEM profession. STEM, of course, is that science, technology, engineering, and math. So when you think of those courses, you think of things like engineers and scientists that, work in labs and all of these types of things. And you don't necessarily think of nursing in that field, but what you need to know is the same skills that would make you successful in a STEM profession are the skills necessary in nursing. You need to be able to read and communicate well because you are going to be communicating with lots of people, including your patients. You need math skills simply because you're going to be doing dosage calculation. And historically, dosage calculation, when done incorrectly, harms patients and can lead to patient death. And you certainly don't want to be a nurse who's responsible for that. And then the strong critical thinking skills, while you're not even sure maybe what those look like right now, I can guarantee you that as you progress in the program, HACC helps to build those critical thinking skills into you. But these are things that you'd at least want to assess as you enter the program. Do I feel like I'm ready from a English, science, and math perspective? Because if not, it may benefit you to take some more courses before you enter the nursing clinical area. So HACC offers a number of different programs, different ways to achieve a PN or an RN. So that's what we're going to look at here. We offer nursing at 4 campuses. You can see them listed there. Our Harrisburg, Gettysburg, Lancaster, and York campus all offer nursing programs. They don't all offer the same ones, however. The PN program is offered at 3 of those campuses. The Gettysburg campus currently does not offer a PN program, so you can't go to Gettysburg and take PN courses. All of our PN programs are 4 semesters long, and I have some slides where we'll talk about that in a little more detail. For the RN program, the degree you earn, that ASN you see there, stands for an Associate of Science in Nursing. So that's the degree you earn at the end of your program at HACC, an Associate's degree of Science in Nursing. Now, we offer a variety of different ways to get that degree. One of them is what we call the 4-semester traditional option. So that is 4 semesters in length. It does not utilize summer semesters. And again, we'll look at this in a little more detail. That 4-semester traditional option is offered at 3 of our campuses. As you see, York does not offer the 4-semester traditional option. What York does offer is an 8-semester day option. It takes 8 consecutive semesters from the time that you start, and it has classes during the day with some weekend clinical. We'll look at more of that in more detail. The final offerings are an 8-semester evening option, and that is offered at all 4 campuses, and our new 4-semester weekend option, which just started this past fall, and it is offered only on the Harrisburg campus currently. Now, there may be some changes in the future where we add new programs at different campuses. We're always looking to expand and to hopefully grow our program, but currently, these are the campuses and the programs that you can enter to achieve either a PN or an RN, and we'll look at all of these in a little more detail. So what does class look like for a HACC student? What are you going to get into? Well, we are a concept-based curriculum, and while you may not know what that means, essentially the old model. I'm a HACC grad. I graduated from the HACC nursing program, and so when I learned nursing at HACC, it was set up more on the medical model. And what the medical model means is that you are learning all about the different diseases and the pathophysiology of those diseases and the treatment for those diseases. And it's really memorizing diseases and the treatment of those diseases, kind of like a medical student would as they were going on for becoming a medical doctor. But that's not really good for nursing because we're not medical doctors. We have different roles, we have different responsibilities. And so teaching us like a doctor is not necessarily the best option. So most nursing schools, many I should say, in the country have gone to a concept-based curriculum. And what that looks like is instead of teaching you all the different diseases, we teach you the broad concepts first. For example, perfusion is a concept. So what we would teach you is, what does perfusion look like in a patient? What things make up perfusion? What does good perfusion look like in a patient? What does bad perfusion look like in a patient? How do I assess perfusion in my patient? What do I do if my patient has bad perfusion? All of that generically about perfusion. And then we'll teach you some of the specific diseases that affect perfusion. And guess what? All of those diseases present very similarly because they all affect perfusion. So whether you're learning about dysrhythmias or shock or peripheral vascular disease or myocardial infarction, those are all perfusion concepts. And so you're learning the specifics, but you already generally know how to care for these patients. Because if they're having poor perfusion because of a heart attack, you're going to do very similar things to if they're having poor perfusion because of a dysrhythmia. So by knowing about perfusion, you can take that to any situation where your patient has poor perfusion. So it's a much better way to learn as a nurse in the way that we care for patients. We utilize a flipped classroom, and a flipped classroom simply means that there is going to be less lecture and more interactive classroom experiences. We utilize things like case studies and how the patient is cared for in the hospital. There's a lot more group work, videos, and interactive sessions within a classroom. There is certainly lecture still, but it's not going to be like a situation where you go to history class and you listen to your lecture for 3 hours and then you're done and all you're doing is taking notes. There is some expectation that you do some work ahead of time in class before class, so that when you show up to class, you are ready to participate in some of these flipped classroom experiences. And then every campus, all 4 that offer nursing programs, have a simulation lab. And within that simulation lab is a lot of equipment, but we utilize all of that equipment, including some of our higher level mannequins, to do simulations. It gives you a safe learning environment where you can care for a simulated patient. And some of these patients have heartbeats and breath sounds and blood pressures you can get and IVs you can put in. There's a lot you can do with these more updated mannequins. And the Harrisburg campus is getting a brand new one in about 2 weeks. So there is a lot of learning that you can do in this sim lab under safe and supervised conditions before you ever go out to clinical and take care of a real patient. So whether you have a lot of healthcare experience or no healthcare experience, like I had when I entered the nursing profession and nursing school, we help you to learn in a safe environment so that you are able to build the skills before you go out into the actual clinical setting and care for real patients. So what does clinical look like when you are in nursing school? What's involved in clinical? Well, there's 2 pieces. There's a clinical lab piece, and that simply describes the work you do within the simulation lab. That's where you're practicing your skills, things like injections and med passes and how to insert catheters, how to do a sterile dressing change, how to care for your patient like you're in the hospital, but within the lab setting. And then there are more experiences where you go out into the hospitals and you care for patients directly face to face. And we utilize a variety of different scenes for this: hospitals, clinics, daycare, schools. There are a lot of places our students go for their actual clinical experiences. And it all depends on the course you're in, the campus you're on, the level you are. All of that varies in where you might go any given semester. Currently, we all know that HACC is within a remote learning environment. And so that does change nursing school. And you may have questions about what that looks like. So currently, we are in this spring remote for class. And there is already a decision that summer courses in the nursing as well as across HACC will remain remote. We do not have a final decision yet on what fall looks like, although that decision is likely to come in the next couple weeks. So until we know for sure what fall is going to look like, I'm just sharing with you what we're currently doing. So class involves both podcasted lectures, so recorded lectures you can listen to, as well as what's called synchronous sessions. And when you're talking in education, synchronous just means that it occurs at the same time. Everybody's together. So we would have a class during normal class time. The difference is you'd be on Zoom just like you are now, listening to me lecture just like you are now. So this is very similar to what a class would be. And then of course we would do group work and other things during this class, but there would be a combo of recorded lectures and synchronous sessions where you are learning face-to-face with your instructor. So that's what class looks like. That will continue through summer at least, perhaps into fall, but we don't know yet. The clinical lab has both a combination of video skills practice, and what that means is that you are videotaping yourself practicing your skills. And for some of our skills, the less significant skills, you are recording yourself for a grade. And then there are Zoom sessions for skill development. We do have a few days in our skills courses currently, and it will continue through summer, where students are on campus for a couple days to demonstrate face-to-face skills. And so those skills that the program is deemed to be most important, that we need a face-to-face person to watch you perform those skills, you would come to campus and you would do that face-to-face. Now, I have great news in that some of our skills courses for fall have been given approval to be on campus. So all of your skills practice and all of your skills demonstration for the fall, if you were to start in the fall, would be on campus. The lectures would remain remote, but the skills practice and the skills demonstrations, instead of being sort of recorded, sort of face-to-face, would all be face-to-face, which is a huge benefit to you as students. Finally, clinical. In this remote environment, we are so blessed that the hospitals have not totally closed down to us. Different hospitals have different requirements. Some are not accepting students. But what we have done is work very hard to guarantee that this spring and this summer, our students have 100% face-to-face with patients. What that means is, for your clinical experiences, students are in the hospitals caring for patients. They may be in class on Zoom, but they are not doing remote and assignments for their clinical. They are caring for patients, giving meds, doing everything at the bedside that we would want them to be doing. And that will continue through spring and summer, with the hope that, again, that will continue for the rest of our nursing semesters. But that's where we are right now. And again, the decision for fall still remains open. So we'll have to see how that plays out. I'm going to just pause here and see if you guys have any questions about anything I've shared up to this point. I know it's a lot of information. I'm going to now get into the actual practical nursing program and what it looks like in a little more detail, and then the RN program follows that. So if your questions are more about that, you can certainly hold them and see if I answer it. But anybody have any questions up to this point? Okay. So I hopefully have answered them, and Mrs. Kazmi, I know, is working with some of those chats as well. So I will keep on going, and I will pause again in the future, and don't hesitate to ask. That's why you guys are here. Hopefully you all haven't fallen asleep on me yet. That's why I'm drinking coffee, because I know it's not easy to listen to somebody just blab on for 2 straight hours. Trust me, my students have to do it sometimes. So what is a practical nurse? I've kind of already described a little bit some of the roles that the practical nurse does, but they provide basic nursing care. They work under a registered nurse and doctors. They are part of the healthcare team. They just have a different scope of practice than an RN or a physician has. As an LPN, or a licensed practical nurse, you can work in any number of places. And I will tell you that currently the healthcare environment loves LPNs. They are hiring LPNs in all different areas. My background is emergency nursing. I graduated from HACC and I worked in the Harrisburg Emergency Department for 11 years until I took the job of director here on the Harrisburg campus. So my background is emergency nursing, and I can tell you, in the emergency department, we have LPNs working. So if you enjoy the emergency department and that more critical patient scenarios and working with that type of environment, you can work as an LPN in the ED. The ICUs are hiring LPNs. Floors are hiring LPNs, doctors' offices all over. So there is plenty of opportunity as an LPN to get a job, not just in the nursing homes, which you may imagine is where most LPNs work. It's not. There's all different areas an LPN can work. You do work a lot of rotating shifts. It all depends on where you work. It's not a typical 9 to 5 job generally. So please know that as you go into nursing, unless you're lucky enough to find those few and far between jobs that are day shift only, you will likely be hired in as some type of split. I was hired in as a day evening nurse. So I could work anywhere from 7 a.m. to 3 a.m. The only 4 hours that I was not expected to be at work would be 3 a.m. to 7 a.m. But you could be hired in as a day night or an evening night. And so then you have rotating shifts. So it all depends on where you work, what your hours are going to be. Basically, as an LPN currently in the Pennsylvania area, new graduates are earning about $44,000 a year as entry level, and it goes up from there. If you were to go on for your RN, obviously you're going to get a higher salary based upon that additional education, as well as the additional responsibilities that go with that. So why choose HACC's PN program? Well, you should know HACC has the highest NCLEX pass rates in the state. We are currently at 100%. So every single student who graduated from our program last year passed NCLEX on the first try, which is a phenomenal outcome. I'm so proud of our PN faculty. So please know that if you join the HACC PN program, you are joining one of the state's best PN programs. And I am a little biased because I'm the director of the program, as well as, of course, a HACC grad. So I love the HACC nursing program. But that being said, this is just factual information. We have the highest pass rates in the state. The PN program is a 15-month program. We utilize the concept-based program in the PN program, just like the RN. It is 4 consecutive semesters. It always starts in fall. So all 3 of those campuses, York, Lancaster, and Harrisburg, they all start in the fall, and they go fall, spring, summer, fall, 4 consecutive semesters, and they graduate the following December from when they start. All of our PN programs are now what we call 100% stackable. And what that means is, as a graduate of HACC's new LPN program, you are able to submit a transfer into our RN program, only HACC's RN program, to achieve this. And all you need to do is take 4 additional nursing courses and 4 additional gen ed courses, which many of you may have already taken some of those gen eds in preparation for the RN program. And with those 4 additional nursing courses, you can then graduate with your Associate of Science and earn more money, as well as continue to receive financial aid because it's a continuation of the program. And I have a little more information on what that looks like here coming up. So the time commitment. In the PN program, again, we start only in fall. So the next fall coming up, obviously, is August of 2021. Students accepted into the program would start in August, and they would graduate in December of 2022. Make no mistake, the PN program is a time-intensive program. The state mandates that all PN graduates must have 900 clinical hours. So we have to get you 900 hours within those 4 semesters. And that's just for clinical, the actual caring of patients. That doesn't include class and everything else. So it is a 4 to 5 day a week commitment every semester. So timing in the PN program, you're going to give a lot of time to the PN program. Class and theory typically falls 1 to 2 days a week. And again, it varies by campus a little bit, but you can see some examples there. The first fall, you are in class about 3 hours for the class. In the spring and in the second fall, it's 2 days a week. Again, about 3 to 6 hours of class. And then in the summer, we utilize 1 day a week of class, but it's a very long day, 8 hours. And that is simply because in the summer, HACC's campuses are closed on Fridays. So everything we need to do is Monday to Thursday. So because of that, you have class 1 day a week, but it is an 8-hour day in the summer. And then you can see clinical is likely 3 days a week. So if you're in class 2 days a week and you're in clinical 3 days a week, you get the idea. That's a 5 day a week commitment. And again, depending on the semester, depending on the campus. These days may vary a little bit, but typically it's like a Monday, Wednesday, Friday clinical or a Tuesday, Wednesday, Thursday clinical in the summer. So you can see your class days are typically going to fall on Tuesday, Thursday for the spring and fall, or Mondays in the summer. Okay. So what will I take and when? What's the sequencing for this? Well, if you were to start this fall, here's what the sequence looks like. What we have here, and you'll see this table again and again because I've utilized the same idea over and over again, but you get accepted into the program, and prior to ever coming in the fall, you must have taken and passed Biology 121. That is A&P 1. So A&P 1 is a hard stop for entering the nursing courses. If you do not have a passing grade on your transcript, whether it be taken at HACC or another college, by the start of these nursing courses in August, you will not start with the rest of the students. So you can take it in the summer, but you must finish it successfully in the summer in order to start in the fall, okay? Now, these other gen eds that I have listed here, some of them you can take as you wish. The psych and the English and the speech, you may already have done, or you may want to take them in different semesters. We're just showing you when you could take them. But the Biology 121 has to be finished prior to the entrance into the nursing courses, okay? So you can see here that in the fall, you take 3 practical nursing courses, and again, 3 in the spring, 4 in the summer, and 3 in the fall, and you can see the credit totals there. What I want to point out is for those students who are dependent upon financial aid, for students who need some form of financial aid to help cover the cost of their courses, financial aid begins paying out at 6 credits or more. So if you are taking less than 6 credits in a semester, you do not qualify for financial aid. So what you need to pay attention to is for all of these other semesters, the practical nursing courses alone total more than 6. So you're okay if all you're taking is the PN courses. But take a look in this first semester, 3 credits of PN courses only. So what that means is if that's the only courses you need to take in the fall because you have all your other gen eds done, you do not qualify in and of itself for financial aid. So you would want to add an additional 3 credit course to the fall to be sure that you meet financial aid requirements. If you already have all of these done, then perhaps you don't have one of the ones done that's needed for the RN program, like English 102 or something like that. And you could take that during this semester. But again, I want to just point out for financial aid reasons, you need to pay attention to your credit load to be sure you meet the requirements. But this would be an approximate sequencing. I will tell you that the nursing courses, so you can't alter the sequencing of the courses. You need to take 140 and 142 to enter the spring. So you can't just say, well, can't I just take 140 in the spring and just add up more in that? That is not the way the program works. You must take the courses in the assigned semesters in order to move on throughout the program, okay? So these ones in black are non-movable or non-negotiable, so to speak. The ones in blue, other than Biology 121, do have a little bit of flexibility, okay? Any questions about the sequencing or the timing requirements of the PN program? Anything I didn't cover that you want to know? Are you all afraid to speak up because we're recording? Is that what it is? I'm talking for 2 hours and I'm being recorded. This is being recorded right now. I don't care. All right, then I'm going to keep on going. So why might you consider moving on from HACC's LPN program to HACC's RN program? Because I already described that that's an opportunity, right? Where you can just do the 4 additional nursing courses. Well, here's some thoughts. Sometimes we have students who want to be an RN, but because of our admission criteria, they have difficulty scoring a 70 or above on the T's. And I'll talk about the T's here in just a little bit. We have a baseline T's requirement of 70 or above to apply to the RN program. Sometimes students struggle to get that. Well, what we have found is if students have a lower score than 70, they can go into the the PN program, go through the PN program, and then by the end of the PN program, they've had enough additional material and enough additional learning and growth that they're able to score that 70 on the T's and get into the RN program. So it is a way to build your knowledge so that you can do better on the T's and get into the RN program, okay? And then maybe you're a student who wants to complete the program and just earn a higher wage sooner. Well, this LPN to RN is a way to do it quickly. It is a way to graduate and even work as an LPN, earning that higher wage while you're completing your RN requirements in the program. And then, of course, since you only have 4 courses left to finish, you are able to do that relatively quickly and earn that RN very quickly versus going to another school and trying to finish your RN somewhere else. So this is an approximate schedule for what the transitional students might see. So this is those that have finished the LPN program and are interested in the RN program. Because it's now 100% stackable, which I already described, what that means, of course, is that you get a 1-for-1 credit for all of these courses that you already took in the PN program. So these are all courses that you take in the PN program. They have a nursing equivalent. So we give you credit for all of these equivalent courses in the nursing program. That only leaves you with these 4 courses in black: Nursing 240 and 241, 250 and 251. Those are the only 4 nursing courses left to you as an LPN graduate of our program. Now you see that the 4 additional gen eds are listed in blue here. And so the other ones you would still need to take are your second English, your math, your elective, and A&P 2. You must have A&P 2 done prior to your entrance into Nursing 240. So it is a hard stop for those graduating from our LPN program if they don't finish A&P 2 prior to entering the semester where they take Nursing 240. So you can see that an LPN graduate could graduate in December, take their spring and summer to pass their NCLEX, get a job, start working, earning some money, and then re-enter the RN program the following fall and take 2 courses here and 2 courses here and be done. All right. The other option that we have, which is a new offering just starting this March, is what we are calling the LPN to RN stackable cohort. And what that is a special cohort of students just for our LPN graduates. And assuming that they are able to take and pass their NCLEX by March, and they have a T-score of 70 or higher and a GPA of 2.5 or higher, they can start immediately in the following March and take a 7-week course from March to May for 240, a 6-week course from May to end of June for 241, a 6-week course from July to August for 250, and a 7-week course from August to October for 251. So this LPN to RN stackable cohort goes late spring, early summer, late summer, early fall, and you would graduate with your RN in October of the year after you graduate the LPN program. So basically 10 months later. It is a fast way to finish the LPN program and turn right around and finish your RN 10 months later. So again, that's a new LPN to RN stackable cohort that is an option for our new graduates of our LPN program. They're just starting it this March. So again, something to keep in mind if you're interested in going from LPN to RN quickly. What about for those that are not in the new LPN program? We have graduates of our older LPN program prior to 2020. So anybody that graduated 2019 or earlier from HACC is considered a graduate of our old LPN program. And we also have students that didn't even graduate from HACC, but are LPNs. They might have gone to somewhere else, right? And so they need to get their RN, they're interested in their RN, what's in it for them to come to HACC? Well, we do offer what's called advanced standing to these LPNs. So these students do not get a 1-for-1 credit because they didn't take the same courses that the new PNs are taking. But what they do get is immediate credit for 3 nursing courses and the opportunity to test out of 4 additional courses. So you have the opportunity to get credit for up to 7 courses in the RN program as an old HACC LPN or a graduate of some other LPN program. And I've got lots more information on this if this fits you. Obviously, this might not be the right time to get into all of that test out information and how that works, but I am happy if you email me, and I know Mrs. Casmi will provide my email address in the chat. You may reach out to me privately, and I am happy to go through that process of what the test out looks like and how that happens. But just know as an LPN, even if you're not a graduate of the new LPN program, there is still some advanced standing and some benefit to you coming into the HACC RN program, okay? Questions about the LPN program? That's a lot of information, I know. Anything that you would like to know that I didn't cover about LPNs?
Hi, Mark. Do you have an estimated cost for that, the new PN to RN bridge?
So you mean just the actual RN courses once you finish the LPN program, or the total cost sort of from beginning to end?
The cost from once you finish the PN into the RN.
Great question. I don't, but I can get it to you, Kyle. If you put your email in chat, or if you send me a question, Kyle, Mrs. Kesme just put in my email address, just send me that question via email and I'll work out the cost for you. It won't take me very long, but I'll get you the answer.
Okay, excellent. Thank you.
Absolutely.
This is Robert.
Hi, Robert.
Is anatomy and physiology, biology 121, is that completely online?
It is currently, yes, sir. Yep, they offer biology 121 and 122 and 221, which is the micro, all currently 100% online. You do have to still take the lab with the course, but the lab itself is online as well.
Okay, thank you.
You're welcome.
This is Patricia. I'm actually an advisor in Harrisburg. So I wanted to clarify one of the questions in the chat.
Thank you, Patricia. Go ahead.
It says from Christina, in the event I do not score a 70 or higher in the T's to attend the ASN, what semester will I be able to enroll in the LPN until I can successfully pass the T's as required? I'm assuming that the student is asking if she can get into the LPN program and then successfully pass the T's to get a competitive score, remove herself from the LPN program and attend the RN program. And is that a thing, or does a student then have to complete the LPN program and then apply for the RN program?
That's a great question. Wonderful question. So in order to qualify for the 100% stackable credit to credit transfer, you must finish the LPN program and take the NCLEX and pass it. That is when the 100% credit to credit transfer applies. So let's say you started the LPN program and took the practical nursing 140 and 141 and 143 or something like that. And then you decided you got a good enough score to join the RN program instead. If you drop out of the LPN, which you may do, you will not get credit for those 3 courses in the RN program. You will be starting from scratch. The only way to get the direct credit is to finish the LPN program, graduate, and pass NCLEX, and then transfer in. But yet you can certainly start it and then drop it if you want. I just would feel terrible because that's wasted time and money that you are putting towards something that you're not going to get credit for.
Mark, there was another question in the chat about the time length between starting the LPN and then finishing the LPN, as well as finishing the LPN to RN completion. What is the time from starting to finish if you do the LPN and then the LPN to RN?
Good. So the fastest way to do it, because it's going to vary depending on your individual situation, the fastest way to do it would be the LPN program, which is the 4 consecutive semesters. Let's use an example of the students that are already in the program. So they started this past fall, 2020. They will graduate in December of this year, December 2021. So it'll take them 15 months or 4 consecutive semesters to finish the LPN program. Then between December and March, they will go out and they will take their NCLEX PN program, or excuse me, their NCLEX PN exam. And assuming that they pass it and meet the other entrance criteria, which is the T-score of 70 and the GPA of 2.5 or higher, as well as the biology 122 being finished, they may submit an application to enter directly into that LPN to RN stackable cohort, which is the fastest. It is considered a guaranteed seat in that cohort only if you meet criteria. So I can start you in March and you will finish in October. So from December 2021 till October 2022, they will finish their RN program. So in total, it's about 2 years, right? Fall of 2020 to fall of 2022, 2 years to earn your LPN and your RN. That's the fastest. Now, if you don't want to join that March cohort as an LPN graduate, you don't have to. There are other programs and other offerings you can join. But once you submit to those, it is acceptance is space dependent. It is not a guarantee like it is in that March cohort. You would be asked to be put on a waiting list to be sure that there is space in your requested cohort, the group you want to join, and then you would follow whatever progression that cohort is. If you join the evening group, you would take courses with the evening group and graduate when they graduate. If you join the weekend group, you take courses with the weekend group and graduate when they graduate. So it would all depend on which program and cohort you joined when you would graduate and how fast it would happen. The fastest would be the March LPN to RN stackable cohort. Hopefully that answers that question for you. Any other questions? You guys are asking some tough questions. I like it. It's a lot of information, I know. So I appreciate the fact that you guys are seeking out good information, and hopefully you are getting some good information that can help you to make some good decisions. Please know that if you have follow-up questions that I am not answering, I'm always happy to answer emails. Just email me and I will get back to you with whatever information you need. All right, we're turning the corner to the RN program now. So what is a registered nurse? Well, guess what? A registered nurse is very similar to a licensed practical nurse. They care for a lot of different types of individuals across the healthcare spectrum. They are involved in all levels of patient care and education. They work in a variety of settings, just like the LPNs can. The only difference is as their education is slightly higher and their responsibilities are slightly higher, there are more open doors for the RN. You would need to have an RN license to become a floor nursing manager or a clinical manager on a unit or something like that. They would have the RNs do that, not the LPNs, and so on. So as you want to elevate your education and you want to elevate your status and position within a program or a hospital or organization, you would likely need to be an RN to do so. The amount of vertical growth that an LPN can do is more limited than the amount of vertical growth that an RN can do. Locally, new graduates are earning approximately $30 an hour or somewhere around $62,000 a year. And again, it can go up from there. So the pay for new RN graduates locally is good. There's a lot of opportunities out there, I promise. We have a lot of healthcare organizations and a lot of hospitals in this area. Penn State is building a brand new hospital by the West Shore Hospital in Hampton. There is a new hospital going up down in Lancaster. There is all different opportunities for nurses and for hiring in this area. Again, you can further your education by getting more advanced degrees, getting your master's degree, and then you can work as a nurse practitioner if you go to school for that. Their earning potential is $100,000 plus per year, and the highest paid nurses are the nurse anesthetists. So those are the ones that work in the operating room along with the anesthesiologist to put patients to sleep and to monitor them during surgeries. They have a very high responsibility and a very high education level, and so therefore they get paid well for it. $140,000 plus to start as a nurse anesthetist. So why choose the HACC RN program? Well, take it from me, it is one of the best in the state, not because I'm a graduate of it and a director in it, although that does contribute, but I will tell you that it is a wonderful program. We hear regularly from all of our area hospitals in Lancaster and York and Gettysburg, not just in Harrisburg, when they are looking to hire and they are looking at a HACC grad or they are looking at some other grad of another program, even a bachelor's level program, 9 times out of 10, they will hire the HACC grad because they know the education they receive, they know the clinical skills they possess, and they know that they are ready to work. And so we have, as HACC grads, one of the most highly sought after nursing graduates in the state. We also currently have the largest nursing program in the state. When you consider all 4 campuses, the HACC nursing program is the largest in the state. Consistently, we have very high NCLEX pass rates in the 90s, which means it's not quite as high as the PN program at 100%, but the trend right now is going up. So we are continuing to improve, and we have goals in place and programs in place to improve our NCLEX RN pass rates. It is a concept-based curriculum. We are nurse leaders in many of our area hospitals. Now, they have gone on past their associate's degree to get bachelor's and master's degrees, but they started at HACC. And many of our chief nursing officers or our vice presidents even of local hospitals are HACC grads. So it is a well-documented thing that our HACC grads are ready to work and they make wonderful nurses. And locally, recently, nursing leadership praised HACC's graduates during the COVID-19 pandemic, and you can see the quote there. It was HACC grads and their knowledge of isolation procedures that helped to contribute to infection control within the hospitals during the early days of the COVID-19 pandemic. So again, as a HACC grad, you are going to be prepared to work in the hospitals. Now, I said way back when that we have a lot of different types of programs to get to that Associate of Science in Nursing. So now I'm going to break down which each of these programs are, because when you join HACC and you apply to HACC, you are applying to one of these programs. And these programs then dictate when you take your courses and how your progression happens. So you are joining a specific program and a specific cohort when you apply. So the traditional 4-semester program is a 4-semester program that utilizes only fall and spring semesters. There are no summer nursing courses as part of the traditional 4-semester program. So therefore, class is 2 to 3 days a week. Most semesters, it will be 2 days a week. And class can be anywhere from 8 to 4 p.m. Clinical is 2 days a week. And again, they vary by campus and course, but they can include both daytime clinicals or evening clinicals. This is not a day-only program. This is a 4-semester program where we utilize daytime classes, but we also utilize on all of the campuses day or evening clinicals. So you can't assume you will have everything during the day when you are joining this 4-semester traditional program. Evening clinicals happen. This is the sequencing for the traditional program, and I started it in fall simply because that's the next time we accept students in. And so again, this looks very similar to the PN and what you've already seen, but I just want to point out that again, this biology 121, the A&P 1, must be completed prior to your entrance into the nursing courses. So if you haven't taken it yet and you're not taking it this spring, but you want to start in fall, you must take biology 121 in summer. It is your only option to be able to start in fall if you don't already have it, okay? So then again, the nursing courses are in black, and as part of this 4-semester program, traditional, they are not movable or negotiable. These are when you will take the courses. In fall, you will take these 5 courses and so on throughout the semesters, with a spring of 2023 graduation. May of 2023, students that start this fall in this program will graduate. Now notice that the nursing credits always total more than 6 in each of the semesters. And so therefore, you will always meet minimum financial aid requirements in the 4-semester traditional program. Please note that there are some other hard stops that we have within the program as well. Biology 122, this one right here, A&P 2, has to be taken prior to nursing 150. So this is nursing 150. You take it in your 2nd semester as part of this program. So you would have to take biology 122 in the summer or fall, if you don't already have it, in order to move into the spring semester. If you do not finish it by the start of spring, you will not be allowed to continue on in your nursing courses until you finish A&P 2. So think about that depending on what gen eds you have done or not. These other gen eds like English and psych and so on can be moved around. Notice that you have the summer off from your nursing courses. As I said, in this program specifically, we don't use summer courses. So this is a great opportunity to get some of those gen eds done because you won't be taking nursing courses. The other hard stop is biology 221. It must be taken prior to taking nursing 250, which in this program is during your final semester. So you must have A&P done, A&P 1 done to enter. You must have A&P 2 done to start the 2nd semester, and you must have biology 221 done to enter the final semester. So those biologies are your hard stops to further courses. Okay. The timing of some of these specialties, nursing 242, 243, and 242 are our specialties, OB, pediatrics, and mental health. The timing of those does vary a little bit based on the campus, but the course load is always the same at 2.5 credits. So whether you take OB in this semester or you take OB in this semester, it's the same course load and credit load regardless. Any questions about this setup before I go on to the next one? Okay. So we do have one and one only day program. So in a sense, a more guaranteed day option where we don't utilize late evening clinicals. It is only on the York campus, and it is only an 8-semester program. Okay. Nowhere else do we have what we would consider a day only option. It does include summers. It is an 8-semester consecutive program. You can see here that class times do vary depending on the semester, but they're typically 1 to 2 days a week. And clinical is typically 1 to 2 days a week, every other weekend. So this day program utilizes class during the week, but clinical every other weekend. And you can see the clinicals can run as early as 6 a.m. to as late as 6 p.m. So that is the only day program we offer, where we try to keep everything towards the day hours. Your campus, 8 semesters, that's the only way to do a day only program, okay? Now, what about the 8 semester evening option? All 4 campuses offer this program. So you can take the evening option at any of the campuses. Again, it is 8 consecutive semesters. It includes summers, and you have class typically 1 day a week, and you have clinical typically 1 day a week. Class never starts before 4 p.m. This is an evening only program. No daytime will ever be utilized for this, so it is evening only. Class starts at 4, clinical starts at 4, and it usually ends no later than 11:30. So this is evening only for those students who work during the day 40 hours a week, or have family commitments, childcare commitments, or other commitments that do not allow them to take daytime classes. This is the program that many of them choose because they know they are not going to start class or clinical until at least 4 p.m. Here's what the progression looks like. So again, it goes without saying that the same requirements are here. You have the fact that you must have Biology 121 A&P done before entrance into the nursing courses. And then again, you stack out 8 consecutive semesters, including summers, from when you start. All we've done is taken the 4-semester program and cut it in half. In the 4-semester program, students took 150 and 151 in the same semester. Now they're taking 150 in one semester and 151 in the next semester. So that's why it's an 8-semester program versus a 4. Same hard stops. You must have A&P 2 done before your 3rd semester in this program, and you must have Biology 221 micro done before your 7th semester in this program. So again, keep in mind on that. The other thing you must notice goes back to financial aid. In the 8-semester programs, both the York campus day only and the Harrisburg, Lancaster, York, and Gettysburg evening, you never achieve 6 credits with the nursing courses alone. That is why we have spaced out the gen eds throughout each semester, because if you are dependent upon financial aid, you will never, by nursing courses alone, reach the 6 credits necessary for financial aid. So this program is good for those students who work during the day, but it is also good for those students who are not done with their gen eds. If you have all of your gen eds done already, but you require financial aid, this is probably not the right program for you, because you won't have gen eds to fill in and you won't meet financial aid requirements. So please just keep that in mind as you are thinking about your gen eds, your program choice, and where and how you want to attend the program. Any questions about the 8-semester program sequencing?
We have, Mark, we have a question in the chat.
Sure. Let me take a look and see if I can find it.
The last one.
Is this current slide for the evening setup the same as the day? Yes, it is. Per financial aid, Christina, full-time is 12 credits or more. So to get full-time aid, you must have 12 credits or more. To get part-time aid, you must have 6 credits or more. But the
Mark, there was
sequencing-
another one.
Okay, the sequencing is the same.
And then one of the students asked about the gen eds. If you've taken any of those already, do you need to have there like a time limit on them?
Good question. No, and I have wonderful news. That nursing department has just decided and voted that we will forego for all time and eternity the 7-year limit on sciences as well. So you may have heard that the sciences time out after 7 years. That is no longer the case. So your sciences, if you have already taken A&P 1, A&P 2, and microbiology, even if it was 25 years ago, they count. You do not have to retake them. If they are on your transcript, they count. You will not time out of any of these courses. Any other questions?
So I have a question. You said the sciences do not time out.
That is correct.
So I'm currently in microbiology, and they told me I had to take it because I've taken it. It was like 10 years ago, and they're making me retake that. Do I have to retake that?
Currently, no. We voted last week. It is live as of last week. So I do apologize. It was true at the beginning of the semester that you would have to take it. So the advice you got at the beginning of the semester was true. You should have been directed to retake it because there was a 7-year timeout limit as of January. There is no longer a 7-year timeout as of today. Any other questions?
So I have another question. Since it doesn't time out, can I talk with my advisor about that? Because I'm currently enrolled in the microbiology. Since it doesn't time out, am I able to talk with her and not have to retake this course over?
That would be a discussion you would have to have both with the sort of the registrar's office, the welcome center, and your advisor to be sure that, you know, I can't promise that a tuition reimbursement is going to be possible. That may not be. You could drop the course at this point and it would not hurt you in terms of applying to the RN program, but I cannot guarantee that you would get your money back for the course.
Thank you.
You're welcome.
I have a question based on that line of thinking. And so I realize that we are waiving the repeat past the 7 years. However, how does it apply to the BSN program?
Wonderful. And so 2 thoughts with that, Patricia. Thank you for bringing that up. First and foremost, HACC has foregone that because the reason we had it initially, just so you know, is many bachelor's programs, if you wanted to transfer into a BSN program, did require a 10-year science limit. So basically what we said is we'll put it at 7, and that way you will retake your sciences, you'll have them fresh, and if you get out of the associate degree program, you can transfer right into a BSN program and not worry that they're going to make you retake your sciences. Our advice now is HACC no longer has that requirement. So you could have 25-year-old sciences. However, when you go to transfer into a BSN program, they can still require you to retake those sciences. So once you get out of HACC, you're sort of on your own. If the bachelor's programs that you want to get into, let's say Millersville or something like that, have that requirement, you are going to have to retake your sciences, or you can choose a different program to get your BSN that doesn't have that set up. But please know that your BSN partners may require the same thing. And currently, only nursing has foregone the science requirement. All other health careers currently within HACC still have the 7-year time frame. So if you're thinking about respiratory therapy or thinking about dental or something like that, they have this 7-year limit currently. Only nursing has gotten rid of it. Any other questions about the sequencing here? All right. What about our weekend? Because this is another option that you can choose to apply to. So this is a 4-semester weekend program. And what that does is it is on the Harrisburg campus only. It is 4 consecutive semesters, including summers. And you have class 1 day a week. In the fall and spring, class will be on Fridays during the day for 6 to 8 hours. During the summer, because the Harrisburg, or not just the Harrisburg, all campuses are closed on Fridays, classes on Thursdays for about 6 to 8 hours, all during the day hours. So day classes on either Fridays or Thursdays, and then clinical on Saturdays and or Sundays. Some semesters and some courses, we only have to utilize one of the 2 days. In most of the other semesters and courses, about 3 out of the 4, you will utilize both a Saturday and a Sunday clinical. So most days you're going to be in class Fridays and in clinical Saturday and Sunday, or class on Thursday in the summers, clinical on Saturday and Sunday. Clinical can be both day or evening, just like the other 4 semester program. So it is not a day only program, and they last from 7 to 12 hours, depending on the course and depending on the clinical day. But again, it is weekend only. Nothing will ever occur on that Monday, Tuesday, Wednesday, Thursday of the fall and spring semesters, and nothing will ever occur on the Monday, Tuesday, Wednesday, Fridays of the summer semester. Those days are guaranteed in this program to never have any type of nursing courses. It is best done because of its condensed and fast progression using the summer as well. This is not ideal for students who have no gen eds done, especially if you have work and family commitments, because then you're trying to take all your gen eds during the week and you're in nursing school all day Friday, Saturday, and Sunday. So that can become quite overwhelming. Many of our students find that this is the best program for them if they have most or all of their gen eds done, so that they can focus just on the nursing courses. The progression is as we see it here. Same prerequisite of A&P1 being finished, entering in the fall, and currently the fall is the only start time for this program. So we only accept new students in the fall. So if you can't get into the weekend program this fall, you will have to wait till the following fall to try again if you want the weekend program. Again, you take your nursing courses in black in sequence. There is no way to change the nursing courses, and you would graduate the following December, just like our PNs do. So the timing is very similar to the PNs: fall, spring, summer, fall. You can see, of course, that the sequences are very similar. The requirements are exactly the same, that A&P2 has to be done prior to 150. 221 has to be done prior to 250. Same gen eds as all of the other RN courses. Any questions about the sequencing or timing of the weekend program?
I have a question.
Yeah.
How many people are accepted into this program?
We have a current accepted number of 24. We have talked about going up to 32 this fall, but currently it's 24.
Okay, and then I have actually one other question.
Mm-hmm.
I had a meeting with my advisor back last semester for this semester, and we were talking about programs. She went through my credits and what I had done. She said I only had to take micro and A&P2 left. She said I had 2 gen eds that I didn't need to take because my nursing classes would go over that.
Mm-hmm.
Is that correct?
Correct. So the ones that she's referring to are your PE. Your
Yes.
PE, if you don't have it, your nursing 150 course counts as. It's considered a wellness course. And so it gives you credit for your PE. So nursing 150 is your PE course. And then the other one is your FYS course. And nursing 143 meets your FYS requirement. So if you already have them, you already have them. You're not going to get double credit for them. You meet the requirements. But if you don't have them currently and you get into the nursing program, 143 meets the FYS and 150 meets the PE.
The other course she said I didn't need to take was my humanities elective.
There are no nursing courses that meet the humanities elective. So unless you have that on a previous transcript, or you have a course you've already taken at HACC that meets that requirement, you would still need to take that.
Okay, is that something I could take? I could take like with the fall semester at least.
Sure.
Because that's the only other class besides the PE that I would need to take with for my gen eds.
Yep.
So it would be feasible. Okay.
Absolutely.
Thank you.
You're welcome. Any other questions about the weekend or sequencing?
I have a question. So you just said the days are just Friday, Saturday, and Sunday for the weekend, and it doesn't switch up for like summer or fall?
The only switch up is in summer classes Thursdays.
Oh, okay.
And that's only
Okay.
because the campus is closed on Fridays. So the college won't let us have class on Fridays in the summer. So
Okay.
Friday, Saturday, Sunday for this fall, this spring, and this fall, and then Thursday, Saturday, Sunday for this summer.
Okay. Thank you.
Yes, ma'am. Any other questions?
Mark, I have a quick question.
Of course.
Is there any flexibility in selecting like when our clinical hours are, or is it kind of you get what you get? Like, for instance, would I be able to, take one of the later shifts or one of the earlier shifts? I mean, obviously the evening programs are kind of, a little bit more limited than
Sure.
the traditional. But I didn't know if there was any kind of, give and take that goes
That's a
along
great
with
question. And the simple answer is yes, there is some flexibility. There's no promise that we can ever make, of course, that we're going to be able to do it to accommodate your schedule, but each course has a course coordinator, and that course coordinator, the faculty member's job is, of course, to create the clinical schedule, to manage that, and so they would be the one you would want to talk to. It's up to the individual course coordinators whether they can meet those requests or not, and we do everything we can to meet them. I'm a course coordinator in my courses, and if a student tells me, I've got family responsibilities till, whatever, and I can only be in evening clinicals, I do my best to try to accommodate that. There's no reason we can't at least attempt to. However, of course, at the end of the day, if every single student makes a request, somebody's going to have a no probably. So we do our best, but we can't promise it.
Okay. And then what's the general student to faculty in the clinicals, the
Good.
ratio?
In all programs right now, on average, we have a 1-to-5 ratio. It can be as high as 1-to-8, and it can be as low as 1-to-4. But with these remote days that students have sometimes had in previous semesters, we've really tried to maximize the learning, and so we've dropped the ratio to about 1-to-5 currently.
Okay. And then I guess last question on that would be with virtual learning, I know that you said that the jury's still out on what fall semester is going to end up looking like.
Correct.
Are we working on an option to whether or not students can kind of have the choice with some of those classes that are currently virtual, that they can continue to be completely or partially virtual? Or is that kind of going to be, what we go with is what everybody's doing?
Yeah, that's a great question too. I would say that if we're told we can't be on campus for those courses, they'll have to be remote. There's no option in that. Will there be in the future options and opportunities where instead of being on campus, we have some courses that are offered remote or virtually in place of an on-campus experience? I could see that happening. We haven't finalized any of those details. Obviously, this whole COVID pandemic and the reorganization of how we do school in this case, I mean, everybody's job has changed, but for school, we've seen that there are some things possible that we never thought were possible. So I could see some changes down the line, but for the current situation, I don't know if we'll see that change as of early as fall.
Okay.
Very good questions, guys. So how much is it going to cost me? Mrs. Casmi has sent you this PowerPoint if you did RSVP to her. So you would have access to this PowerPoint. If you were to click on this or open up this link, it would take you to a HACC webpage that gives you the cost breakdown. I'm not going to, for sake of time, go there now, but please know that if you didn't receive this PowerPoint and you want it, all you need to do is just put a little note in chat with your email address, and I know Mrs. Casmi will get you a copy of it. But you can link right out to a cost estimate for both the PN program and the RN program and see exactly how much all of this is going to cost you. Just so you know, generally speaking, if you were to start from scratch, never having any transfer credits, nothing at all at HACC or anywhere else, and you were to start fresh, the RN program from beginning to end would cost you roughly $25,000. That includes everything: uniforms, costs, tuition, fees, you name it. And again, if you have nothing and you start the PN program costs approximately $21,000. So again, there's a lot of costs that you would not have to pay if you already have transfer credits and other things. There's a lot that, you know, you may have already done, but those are approximate costs, and you can see the exact breakdown by going out here to that link and taking a little closer look at it. So let's take a look at what are our admission requirements. We're going to transition now quickly into our admission requirements, what that looks like. The TEAS test, if you've never heard of it, is the test that the HACC uses for entrance into our PN and our RN program. It is a test of academic skills. It measures reading, math, English language, and science. So 4 key areas. It is a multiple choice computer-based test. In order to apply to the RN program, you must score it's scored on a 0 to 100 scale. So you must get a 70 or better to apply to the RN. And to the PN, it's a 60 or better. Now, when you go out to take a test with TEAS, if you sign up through a HACC campus, and we are currently not testing on campus, but there is still the ability to sign up through HACC for exams, and it would be remote testing. If you have the choice between nursing or allied health, it doesn't matter which one you choose. It's the same exam and your scores count the same. Again, there is a link here for some more TEAS info. If you would like to go out to the HACC.edu directly, you can get the link and be able to get some more TEAS info out there. I just cut and put this on here because I want you to know there's a lot of additional support that HACC offers for TEAS. There are study groups. There are other TEAS tutoring sessions and other things that are available if you struggle with the TEAS or you just want some additional help with the TEAS. So please go out to HACC.edu, or you can email any of the 2 people at the bottom of this slide, and they will be able to direct you to some of the TEAS assistance that HACC offers. Please know that we want you to do well on the TEAS, and we do offer help, support, and tutoring to help you do the best you can on the TEAS exam. Just so you know, because TEAS is offered remotely, there are some technical requirements you need to take the TEAS exam. You must have a desktop or laptop computer. You cannot take the TEAS with an iPad, a tablet, an iPhone, or any of those things. That is because it is given through the ATI company, and ATI does not allow those options in their testing. You also must have a video camera, a webcam, either integrated or separate. And you, of course, must have Google Chrome as your option, your browser for taking the TEAS exam. So these are some of the requirements you'll need to take the TEAS remotely. If you don't have access to a laptop computer or a webcam or a desktop computer, HACC does, if they haven't already run out, have PC loans that they can give you. And the link is here for the application to sign up to borrow a computer or a webcam through HACC. It is free. Please, if you don't have access to these things, we don't want that to be a reason you don't take the TEAS exam and apply to nursing. So follow that link and they will help you through the process of obtaining a computer, a laptop, a webcam, whatever you might need to take the TEAS exam. So how do you know you're ready to apply to the practical nursing program? Well, you must have graduated from high school. You must be 18. You must have finished Biology 121 by the start of your nursing courses. And you must have a TEAS score of at least 60 and an overall HACC GPA of 2.5 or higher. And if you're transferring in from another nursing program, you need to come in good standing, which of course means that you don't have any dishonesty issues, HIPAA violations, or other things. Most people are going to start from scratch, so that last one doesn't apply. But you must be able to answer yes to all of those questions in order to be qualified to apply to the PN clinical cohort. Again, it's based on your T-score. So you will apply using your T-score of 60 to 100. And then you will also, excuse me, should you have any additional education, be able to achieve additional points. So when you compete for a spot, you are competing for your T-score plus any of these additional points. You must have at least a 60 or higher just on the T's to apply. You can't score a 59 on the T's and be an EMT and therefore get a 60 and think you can apply. Your T-score alone must be 60. Any of these points are additional that help you compete a little more competitively. But you will get additional points based on if you meet this criteria. It is your highest points only, so they're not cumulative. You don't get 5 for your master's and 4 for your bachelor's and 3 for your associates and add 12 points. You will simply get 5 for your master's. So whatever your highest points are, that's the one we're going to add to your total. What about once you've applied? There's some time between application and the start of your nursing courses. So what happens in the interim? Is there anything that might keep you from starting in that fall semester? Well, you must have maintained an overall HACC GPA of 2.5 or higher. If you took summer courses and you bombed them and your GPA dropped below 2.5 between application and fall, that will keep you from starting. You have to be through your developmental English courses. So if you still are in developmental English by fall, you will not be able to start. You must have tested into or beyond completing Math 080. You must finish A&P 1. We've talked about that. So if you can't answer yes to all of those questions, you will forfeit admission and you will need to apply again in a later cycle. So these have to stay in place or be completed between application and fall. Pay close attention to the date that you get your letter of intent. So when we send an application or an acceptance letter, there's a letter of intent that comes along with that. We need to know if you're interested because we have alternates on an alternate list. And if you don't respond by the date on that intent, we can offer that seat to another student because we need to fill the seats and we need to know if you're interested. So pay attention if you get accepted to when you need to get that intent back. These are your RN requirements for admission. Very similar to the PN. Finished high school, be 18, have taken and passed A&P 1, have a T-score of at least 70, have an overall HACC GPA of 2.5 or higher, and again, be transferring in good standing. And we'd like you to meet with an advisor about nursing so that you can make sure all your ducks are in a row, so to speak. And if you can say yes to those questions, you're ready to apply to the RN programs. Same admission point system, 70 to 100 for your T-score, and then whatever additional points you earn. Now, I didn't mention this on the PN, but I'm going to mention it now. At the time of you completing the application, we will use whatever your highest T-score is. T-scores are good for 3 years. So if you have an old T-score that you would like to use, you may for up to 3 years from the time you took the exam. When you complete your application, we will use the highest score on record at that point. You also may only submit one type of application per cycle. So one PN application and one RN application. The reason for that is, let's say you go out and apply early in the cycle, you complete the application, you have a T-score of 72 and you're feeling pretty good. And then you start to hear from other people that they're scoring 75, 76. And you're thinking, man, my T-score isn't as good as I thought it was. I'm going to go retake the T's and reapply with a higher score. You can't. Once you have submitted that application, that is the only application we will accept. And we will only accept the T-score that is highest when you apply. So make sure you have a T-score you are happy with when you go out to submit that application, okay? Again, in the interim between acceptance and start of clinicals or nursing courses, some things might keep you from starting. You have to maintain your GPA. You have to have completed or placed beyond all developmental math and English. For the RN program, Math 103, which is college algebra, or Math 202 is required. You need one of those two math courses to have as your gen ed. So depending upon which pathway you choose, the developmental courses are different. If you go down the statistics pathway, Math 080 is your developmental leading into statistics. If you are leading into the college algebra pathway, it is Math 091. So you need to just know which developmental you need to take and finish if you need to take a developmental in order to meet those requirements. So again, there's two pathways, a statistics pathway with Math 080 and a college algebra pathway with Math 091. Nursing accepts either. Did you finish Biology 121? Again, before your nursing courses. If you can't answer yes to all of those, you'll forfeit your spot. You'll need to reapply in a later cycle. And again, the date on the letter of intent is important. What about guaranteed admission? You may have heard some of this floating around. The answer is yes, we do offer guaranteed admission, all right? What guaranteed admission means is when you complete the application, you will tell us what campus of the 4 and what program, 4-semester traditional, 4-semester weekend, 8-semester evening. So you'll tell us the campus and the program you want to take, and you will be guaranteed a spot in that cohort if you meet this criteria. All right. Most of it is the same. What I do want to point out is what is different is at the time of application. So not just by the start of the nursing courses, but at the time you fill out the application, you must be through all of your developmental maths and Englishes. So if you're still taking developmental maths during the application cycle, you don't meet guaranteed acceptance criteria. You must also have already passed Biology 121 at the time of application. So if you're in progress with Biology 121 during the application, you don't meet this criteria. If you're planning on taking it in the summer after application, you don't meet this criteria. To meet this criteria, developmentals must be done at the time of application. Biology 121 must be done at the time of application, and your T-score needs to be 85 or higher. So those are the key differences. Those three things, plus all the other normal things, give you guaranteed acceptance. Questions about any of that applications stuff?
I have a question.
Yes, ma'am.
So I know at the bottom it said we could submit, for instance, I'm a medical assistant certified. Where do I have to submit that to do I just submit that with my application?
Yeah, there's a question on there and then a chance to verify that during the application. So you'll get a point for that.
Okay, perfect.
Yep.
Thank you.
You're welcome. Kyle said, I've completed a college level calculus course. Will this allow me to place out of the required math credits? Most likely, yes. Our nursing chair, Mrs. Filburn, makes that final requirement, but I just submitted a math substitution for a calculus course for Math 103. So most likely she would approve that as a math substitute, and you would not be required to take a math course if you have calculus in this case.
Thanks, Mark.
Yep.
Also wondering, is there, you'd mentioned that we need to get in touch with a nursing advisor. Is there a specific person that you'd like us to get into contact with, or just check on HACC's website and go ahead and
I don't want to put you on the spot, Patricia, but you are one of our wonderful counselor advisors. You want to help our student here?
So you should have been, if you're listed as a current nursing student, you should have been assigned a permanent advisor who should specialize in nursing. And you can see that person's information when you log into your MyHACC portal. It's in the upper right-hand corner in that blue box. By clicking in there, you'll have their contact information.
So I am not a current HACC student.
So outside of that, you're welcome to call our advising reception desk We also have drop-ins. So if you go to hacc.edu, scroll the whole way down to the bottom and go to advising, there is a drop-in Zoom link as well as the reception phone number on there, and they can connect you with a walk-in advisor at the time that you call or Zoom.
Awesome, thank you.
You're welcome.
Thank you, Patricia. Anybody else questions about that? I'm going to get into the actual application and that in here in just a second. I know we're close on time for some of this, but I am going to keep pushing forward. If you need to take a break, obviously take a break. I'm not going to for the sake of time, but you guys are welcome to step away. So Megan asked in the chat, are there fall and spring starts at all the campuses? Megan, I'm going to answer that question in just a little bit, so hang in there. I'm going to get to that, I promise.
Thank you.
You're welcome. So when are these programs offered? Ah, Megan, look how you led into that perfectly. So summer start. Our York campus has a summer start only, and that's the only time they start new cohorts. So applications are currently open for both the 8-semester day and the 8-semester evening options on the York campus only. It closes March 15th. Okay, so you have a couple, 6 weeks-ish to get that, 5 weeks to get that application in if the York campus is where you would like to attend. So that is for summer 2021 starts. Okay. What about fall? What do we start in the fall? A whole lot, basically. So here's what we start in the fall. We have the 4-semester traditional, which I described as no summers. Remember, fall, spring only. They begin at Harrisburg, Lancaster, and Gettysburg. Okay, so Harrisburg, Lancaster, and Gettysburg begin a brand new cohort of 4-semester traditional students in this fall. We also are beginning the weekend option cohort, which is a 4-semester cohort, but it's not the traditional cohort, at Harrisburg as well. So Harrisburg is offering a 4-semester traditional and the 4-semester weekend. Lancaster and Gettysburg are offering the 4-semester traditional only. For a fall start, in the 8-semester evening, only Lancaster and Gettysburg are starting in the fall. Harrisburg does not have a new cohort of 8-semester evening students starting this fall. Harrisburg begins only in spring. Gettysburg begins only in fall in that 8-semester program. Lancaster begins both spring and fall for the 8-semester evening. PN programs, like I said, start only in the fall. So Harrisburg, Lancaster, and York are all enrolling for the fall PN programs. So take a look. We are starting 1, 2, 3, 4, 5, 6, 7, 8, 9 different nursing cohorts this fall. Between all campuses and all programs, there will be 9 different cohorts of students starting this fall. All right. Applications for fall open on April 1st, close on May 15th for the RN program. Okay, April 1st to May 15th. Applications open April 1st to June 5th for the PN. The reason the PN stays open a little longer is because in the interim between May 15th and June 5th, we let you know whether you made it into the RN program or not. So if you applied to the RN program and didn't get in, you still have opportunity to apply to the PN program and seek a seat in the PN program. And again, remember, you can do that whole LPN to RN transitional and get done almost as fast. So I just want you to know, if you don't get into the RN, consider the PN as a possible application starting point for fall, all right? What about next spring? What do we start for those that are thinking that far out? Again, Harrisburg, Lancaster, and Gettysburg start the 4-semester traditionals in spring. We do not start a weekend option in spring, okay? And then Lancaster and Harrisburg start the 8-semester evening. in spring. Gettysburg does not start an 8-semester evening in spring. Okay. There are no PN starts in spring. Applications open April 1st, or excuse me, I'm getting confused, apologize. August 1st and close September 26th for the spring cycle. Okay, so you have until fall till applications open for the spring. How do you apply to the program? Well, you must apply by the deadline. They're listed already. There is a link on the HACC RN page. I've given you the direct link, so you can link directly out to the HACC RN page. There's a lot of good information on there. If you've never known that HACC has an RN page, they give you TEAS information. They give you all kinds of information out there. Link out to the HACC RN page. You will see the link for the application. Currently, the link is there for the York campus summer start. That's what you'll see there. On April 1st, you will see a link for the fall applications. It is one application regardless of the campus and program you're interested in, okay? Be sure you have hit submit at the end of the application, and once you have completed it, it's a SurveyMonkey application, you'll receive a confirmation email. If you did not receive the confirmation, make sure you follow up with your advisor to be sure your application went through successfully, okay? So what are my options when I go to apply? When I'm filling out the application, since it's one application regardless of the campus or program, how do I decide, or how do I tell you where I want to go? Well, one of the questions on the application, towards like 12 or 13 or 14, is a question about ranking your campus and program of choice. And so when you fill out that application, you will tell us, this is my first choice, this is my second choice, this is my third choice, and so on. You may put as many or as few choices on that list as you want, okay? So if you do not put a campus or program on that list, we will not consider you for a spot in that campus or program. If you add it to the list, we will consider you for a spot in that program, okay? So again, you're gonna see lots of options like Harrisburg 4-semester, Gettysburg 4-semester, Harrisburg weekend, and so on. Those are all listed as options. You'll rank them from 1 to however many you want to rank them. If you don't put a number next to it, it is not ranked, okay? So you'll get it when you fill out the application, but if you don't put a number next to it, it won't be included in the rankings, okay? What you will see that you need to pay attention to is when completing it, you will see some additional offerings that say alternate. Alternate is an actual choice that you can rank, all right? So what you need to understand is about alternates. It is a waiting list. So what happens is you may say, I want to get into the Harrisburg Campus weekend program. That is my first choice. That is my most important choice. So I'm going to say Harrisburg 4-semester weekend as number 1. And if I can't get into Harrisburg 4-semester weekend, I want to be considered on the waiting list before any other situation. So then you would rank Harrisburg weekend 4-semester alternate as your second choice. That means if you don't get into the first choice, but I've got space for you on the alternate list, that's where you're going. Even if another clinical spot was open. So I'll describe that a little better, but what you need to know about alternate is it's a real choice. And if that's where you get placed because of your choices, it is a waiting list. It is not a guaranteed admission into the program. You attend orientation, you go through all of the information that the accepted students get, but you don't have a clinical spot unless enough spots open in the actual cohort. All right, so now let me describe to you how this all works, and hopefully it makes sense. So a student says, these are my rankings. I want Harrisburg 4-semester traditional, then I want to be on the alternate list, then I'll be in the evening, and then I'll be on the evening alternate. So what we do is when you apply and we have all the applications in, we simply create a giant spreadsheet from highest points to lowest points, right? You're competing by points, T's plus additional points. We're going to rank you from top to bottom. And whoever's at the top, we're going to look at their first choice and we're going to say, where did they want to go? Okay, Harrisburg 4-semester traditional. Well, I've got nobody on that list, so they're going there. Number 2 on the list, where did they want to go? Okay, Gettysburg 4-semester. I've got nobody on the list. They're going there. And we just keep shuffling people based on their first choices until we get to a name where their first choice is full. There are no more open spots on their first choice. So then what we do is we look at your second choice and we say, what's your second choice? And if there is a spot available on your second choice, that's where you get put, and so on. So let's just give the example of your number 65 on the list, and we are accepting 64 people into the Harrisburg 4-semester traditional. Now, it never happens this way, but for sake of argument, all 64 people ahead of you asked for the 4-semester traditional program. So all 64 of them filled up all the spots on the Harrisburg traditional. And now we get to your name at number 65, and we see you wanted to go to the 4-semester traditional, but it's full. So we go down to your second choice and we see alternate as your second choice. Well, I've got nobody on the alternate list, so you go to the alternate list. Well, guess what? If you had put 8-semester evening as your second choice, you would have gotten into an actual clinical spot with acceptance in a Harrisburg campus program. Not the 4-semester, but an actual clinical program. Because you ranked alternate as your second spot and there was open spots on the alternate list, that's where you went, even though there's an actual clinical spot available as number 3. We go by your choices. So whatever choices you make, that's where we're going to assign you. So be careful about your choices. If you don't rank them the way you really want them to go, you may not get into the campus and program you really want. So that's where the acceptance gets tricky. This is the reason why sometimes students are like, well, Mr. Lieb, I know so-and-so had lower points than me, but they got in. That's unfair. I didn't get accepted, but they did, and they had less points than me. The reason is because they made a choice for a program and a campus that still had spots available and you did not. Okay? That's how people with lower points than you get in and you don't, because you didn't make the same selections they did during the application period. Here's an example where if all of these spots were full, this student would not get in, despite the fact that there are spots available at Lancaster's campus, because you didn't select Lancaster as a potential spot to go. So again, rank your listings carefully, because that's the only way we're going to know where you want to go. We do not make phone calls and say, hey, so-and-so, we have an open spot in the 8th semester. Would you rather have that instead of the one you chose? We have more than 400 applicants every cycle. We can't make 400 phone calls to get everybody in. So we are going to base it on your choices. And I will tell you, sometimes students make very poor choices. I had one poor girl who ranked, she had a score of 84. She ranked alternate as her first choice. Guess where she ended up? On the alternate list, even though she could have gotten into clinical. So be very careful about your choices, okay? If you at all would consider a campus or a program as an option for you to attend, make it a choice. Now, if you live up in State College, which we've had students, and they drive down to the Harrisburg campus for clinical and for class, they probably aren't going to put Lancaster on the list because it's another hour south. They don't want to drive that much further. So Lancaster's probably not on their list. But if you're pretty centrally located and you could attend any one of the campuses or programs, you might want to consider putting it on your list of options. Okay, the more you have on your list, the better your chances of getting in. All right. So what happens if you do get an acceptance letter, but it's not your first choice? It might be your third choice, your fourth choice. Heck, we've gone down to choice number 7 before. on people's lists. So what happens then? You have two options, and they are listed here. Option one is to attend the campus and the program that you are accepted in for 1 semester. And after 1 semester, you can submit a request for transfer between campuses and programs. You can transfer campuses and programs after you've attended 1 semester. And if we have spots in the campus and program that you're seeking transfer into, we will transfer you in and you can come to whatever campus and program you want if space is available. All right. Option two, if you get accepted into a campus or program that you weren't really thinking about, is to decline your acceptance, and you will need to reapply in a future cycle. Those are your two options. Accept what you were given with the option potentially of transferring later, or decline your acceptance and reapply in a future semester. All right, so give some very careful thought to what you're applying to. Here are the dates for when you will be notified if you get in. And you can see that they're not more than a week from the end of the closing of applications. So March 15th, these close, and we'll let you know around the 19th. May 15th, these close, we'll let you know around the 20th, and so on. So you'll know within a week whether you got in or not. All right, it doesn't take long to go through the acceptances. Any questions about that before I finish this out?
Yeah, so if a student applies to the PN and LPN program at the same time, will they find out in the relative time to make a decision, or will one decision come before the other?
I've had students who, well, you'll get notified of the RN first and then the PN, but I've had students that are on an alternate list for the RN and accepted into the PN, and they'll ride out the alternate status on the RN, attend the PN orientation and the RN orientation, and with the hopes of starting in the RN program if somebody drops off or something like that. You can do that.
Hi, Mark. Do you recommend that we apply for HACC as a general student for the fall, and then once the application opens up, go ahead and apply for the RN program, or just apply for the RN program outright?
Well, you'll have to be a HACC student first to apply. So what you'll want to do is begin with a new student application. If you don't have like an H number and you haven't been officially welcomed into the college yet, that would be step one. And that doesn't take much more than filling out the application and going through some questions. You can find that right on HACC.edu's homepage. And then from there, you couldn't apply as soon as you meet the criteria, even if everything hasn't officially been transferred over from your college institutions previous or whatever. You can apply as early as April 1st for the fall acceptance.
Awesome. Thank you.
You bet. All right, I'm going to keep going, but I will pause for questions at the end. So what about once you get in, what are some of the program requirements? Well, just so you know, background checks are required on a yearly basis. 3 background checks are required: a PA criminal history records check, which is the old PA state police background check, an FBI fingerprint check, and a child abuse history clearance. All 3 of those get done yearly that you're in the program. There are some disqualifying background findings that would keep you from starting in nursing. There is an official prohibitive offense procedure that you can find out on HACC.edu on the RN page if you want to compare your charges to the charges on the list. If you have further questions, you can always reach out to me directly, and I would be happy to kind of help you work through that process a little bit. But just know that if you do have charges on your background, not all of them will keep you out of the program, but there are some that will. So you would want to reference that official prohibitive offense procedure. You will need 1 physical throughout the program. It's a once and done thing. It is a spot where you are going to document all of your vaccinations that you have received, and you have to be vaccinated. In addition to that, you also would have a physical exam where a practitioner would say that you meet the physical requirements of the program. There is a yearly drug and alcohol screening that is done as well. The drug screen and alcohol screening must be negative. I do want to point out that last bullet point is important to understand. Due to state versus federal regulations and HACC's current policy, as well as our healthcare partners' policies, No student can be on medical marijuana and be in a health careers program. So that is not an acceptable prescription per HACC and the medical partners we work with that will clear your drug screen. You will still show up as positive and you will not be able to be in the program. So students on medical marijuana cannot currently be in a health careers program successfully. So what should you look for as a prospective student? What should you ask any college that you're thinking about nursing school for? Well, you want to ask about their completion rate, which means how many students start the program and end the program successfully. We have a great completion rate at HACC, something we're very proud of. 80% of our students who start a nursing program complete a nursing program within 3 years. That is great. A lot of schools are in the low 50s for completion rate. So we are very proud of the fact that 80% of our students finish within 3 years. You want to ask about NCLEX pass rates. And currently, I've given you these already. Our RN pass rates are in the low 90s. Our PN pass rate is currently 100%. Again, cost matters. $25,000 is a lot of money for your education, don't get me wrong, but it is a fraction of what other local schools are charging. And by no means am I saying you should not consider the totality of the education you are getting, but $25,000 will get you one semester or less than 1 year at Messiah, not your entire program. And just know that once you graduate from HACC with an RN degree and go on for your bachelor's, your employer will most likely cover the entirety of your bachelor's program costs. So you can get your bachelor's after your associate's degree for no additional cost to you. Job placement currently is 99+% of our grads are employed within 6 months. And we have working relationships with many different bachelor's level partners, Millersville University, Harrisburg University, York College, Eastern Mennonite, on, where they accept 100% of HACC credits. And most of our students can complete a BSN within about 15 months. I've got some additional links for those that want to go out for information, RN, PN, Ts, and other things. So please utilize these again if you have the PowerPoint and you'd like to go out to look at those. I appreciate you guys giving me a few extra minutes. You guys had some great questions and I'm glad that we got some of those answered. Does anybody else have any questions for me? We did such a good job between Mrs. Casmi and Ms. Cooper and myself that nobody has any questions. This is amazing.